We are now starting the panel discussion with regarding addressing patient journeys. We welcome Dr. Omar Yehia. Thank you for joining us. You are the director of the PET-CT and Theranostics unit at MIRC Radiology Center in Egypt. And you're also one of the first ambassadors of the Oncidium Foundation. Thank you for joining this session.
Thank you. Thank you. The pleasure is mine to be here. Thank you very much.
We also welcome Dr. Jean-Antoine, who will explain his journey with the radioligand therapy. He is fighting a prostate cancer currently with radioligand therapy. And also thank you, Dr. Batool, for joining us. Before we start the discussion, I think there is an important mention that I have to present is the RT Connect program that maybe you know, and I think it's important to mention this before the discussion because you will understand the reason. So RT Connect program has been implemented by the Oncidium Foundation last year. And basically it's a donation treatment program, providing treatment for patients who cannot afford this treatment. So it works with like an offer and demand system where the practitioner can submit the case of their patients. And then on the other hand, we have pharmaceuticals companies offering to donate free doses for these patients who could not afford this treatment. So this is really important, and we have as an objective to have 2,000 doses administered in the coming next years for patients in need. And it leads me to the first question for you, Dr. Batool. Could you please share what motivated you to register your center to the RT Connect program?
Thank you for asking me this question, and thank you for this opportunity to talk about it. Here in Dubai, we are founder of Theranostics in UAE and perhaps the most active in the region. And I found it that if we register this officially with you or with the parties that they can contribute to patient care, that would be excellent, because not everyone knows about Dubai and Theranostics. We are a small country, but with big ambition and developments. And you will see in the testimonial of our patient what he was thinking about and what he found in his own country, which he comes from Canada, and he couldn't find the Theranostic there, but he came here and we treated him. So I think the goal was for the benefit of patients and to contribute in healing and treatment of cancer patients.
Thank you, Dr. Batool. So yes, as you mentioned, your patient, Mr. Roger, could not make it to travel here to Dubai, but he accepted to register a video for us. And before we watched this video, Dr. Batool, could you please give us a bit of a context and showcase, you know, the clinical context of Mr. Roger?
In the context of Theranostic, as I explained, UAE is standing above the limits that we are facing, and we established a very good line of Theranostic for our patient at local level and international levels. And here, Mr. Roger is 72 years old male, and he was referred to us from outside clinics. He didn't have any records with us. And in his history, there was that he's suffering from metastatic neuroendocrine tumor with metastasis to the liver and lymph nodes. Actually, when I reviewed his images, he had bulky disease, especially in the liver. So history of multiple myeloma in remission after therapy, and also history of 4 cycles of monotherapy with lutetium-177 dotatate in Al Ain, another city in UAE, And this patient, unfortunately, was stuck in Thailand during the COVID pandemics, and he was not able to carry on with therapy. So he came very late. He came with relapsed disease, and when I compared his images, he had a progressive disease. So we started to do the procedure, and we explained to him his condition and how the things are standing worse than before. However, we never told him that we cannot treat him, and we started the treatment with monotherapy with lutetium dotatate. So I show you some picture. This is how we evaluated him in the first time. This is the MIP image of gallium dotatate PET CT. You can see the extent of disease. Look at the liver, the bulky liver. You cannot find the healthy tissue. It's all occupied by the liver, and the chain of lymphadenopathy with somatostatin overexpression, para-aortic, starting from the retroperitoneal to mesenteric, and he had also in the neck region lymph nodes. And clinically, he was symptomatic with rectal bleeding and nausea, vomiting, abdominal pain. However, luckily, his renal function were good and platelets, and he was stable. So we found him a good candidate for treatment. And he was also optimistic about the therapy. So this is the fused images of his disease to see the fused gallium dotatate PET CT and the PET. Just I wanted to show the extent of disease in the liver. So these are the first image. You can see after 3 cycle of monotherapy with lutetium-177 dotatate. And you can see still the bulky disease is there. And after 6 cycles of lutetium dotatate, little changes. However, bulky disease is still there. In the other images, he improved with lymph adenopathy. However, the disease in the liver was significant. So at that time, we were going to establish the alpha therapy with actinium-225, and I started tandem therapy for him that our German colleagues started with low dose of actinium and lutetium, and together I have given him until now 2 doses of tandem therapy, and you can see in the third image significant resolution of the somatostatin overexpression in the liver, lymphadenopathy. Patient is now, he came as he described, newly born. He didn't have any symptom, and he said he is very, very active, and he was just asking me, how are you doing? You look sick and tired. Yes, this much he was energized by the tandem therapy. So this is briefly about him, and I think you have the testimonials. Yeah, thank you.
Thank you very much, Dr. Batool. Let's now watch the testimonial of Mr. Roger.
I'm Roger Jourdain from Canada. I received up to now six doses of lutetium plus 2 doses of actinium in the last year. The people who treat me for the first cancer, the multiple myeloma, also are the ones that identify the neuroendocrine tumor. So from them, they were the one recommending that kind of treatment, targeted therapy. And I was at that time living in UAE. And when I look at the option, what's available in this sector, in this area for treatment, the options were very limited. There were only a few countries offering that treatment. But suddenly there was one offering the treatment, Al Ain, a small village or small town, I may say, in UAE, which was offering that treatment. Strange enough, this country, small country, had this treatment while all the rest of the world didn't have it. In terms of side effects, somebody who received that may wonder what are the side effects. Well, in my case, I'm probably lucky. I had very little side effect. Yeah, you have a bit of nausea, but that's a bit normal. But in my case, I didn't lose my hair. I find it a bit nauseous, tired, but nothing extravagant. And I keep doing my activity, normal activity, playing tennis and doing things like that. So it was honestly between the past type of experience I had and this one, well, this one was almost a walk in the park. Yeah, financial could be a very big issue, as insurance will not try to cover this because it's expensive. So if there was a way to democratize the price, to make it more affordable for people to live, that would be fantastic. I mean, and again, it's a new territory. This type of treatment looks like a bit of new territory. So if more people can participate in it, I mean, that will probably provide more information, more data for the researcher to move forward. The second one will be your morale. You really have to keep a positive morale about this. Never think about it's the end. In my case, I never thought it was going to be the end. The third thing will be the confidence level with whom you're dealing with. So you have to be comfortable with the doctor with whom you interacted, and you have to have that level of confidence. In this case, I had a lot of confidence in the people who were surrounding me. And yes, it's important. You have to make sure you have a very good connection with the doctor. After that, it's your life. So yeah, I will insist financial concern, moral concern, and the confidence level that you have to have with the people you're working with. Thank you very much for all your help. And again, put some trust in this process. There's a lot of people working behind the scene to make this happen. So my utmost respect to them.
So Dr. Omar Yehia, thank you for being here. We are delighted to welcome one of your patients who traveled from Egypt to be with us today. But before giving him the floor, could you please share with us your experience with the RT Connect program, since your center was a pilot center for this program?
Actually, I'm a nuclear medicine physician working in Egypt. So it really saddens me if I see a patient coming to us to ask for therapy, and he is eligible for this therapy, and this therapy is life-gaining, and now the problem is that we cannot give him the treatment because of the money. It's a big problem to see someone who's going to die because he cannot afford to take the treatment. So I was very happy that Insidium Foundation developed the system. Now I can go online, request doses for the patients who cannot afford to pay for their own treatment, and we've made it. We helped so far, I think, 4 or 5 patients. We were able to bring supported doses for them. They lived longer, they lived better, thanks to Insidium. So thank you for that.
Thank you very much. Could you please provide us with an overview of Dr. Jean-Antoine's case from a medical perspective?
I felt that most of the audience are not nuclear medicine physicians, so I want to make a broader idea of what we're doing here, not just in particular Dr. John. In cancer prostate patients, if they have metastasis, which means that the cancer has spread out of the prostate, like Dr. John, where he was diagnosed in January 2023, so he has cancer outside the prostate. Usually the first line of treatment is hormonal treatment. We call it ADT. For simplicity, let's call it first line hormonal treatment. Patients respond well for a certain period of time, then resistance develops. The cancer cells are resistant to the hormonal treatment. So Dr. John started hormonal treatment, the first line, and then he failed to respond anymore after 1 year because the cancer cells was resistant. What we do after that, we move to the second line hormonal treatment. We call it new generation anti-androgen. Again, patients respond well for a certain period of time, few months, and then unfortunately again resistance develops. So Dr. John took the new generation anti-androgen or the second line hormonal treatment, which unfortunately failed to respond anymore after 7 months. So in these scans, we see more black spots. More black spots means more cancer, so things are not good. At this condition, after using both hormonal treatments, we shift to the chemotherapy. We have the first line and second line chemotherapy. And in the past, after this stage, we did not have any residual lines of treatment. And this is the significance of what we have in radioligand therapy. In the past, we had the class of hormonal treatment, the class of chemotherapy, and that's it. Some patients had genetic mutations, but for the majority of patients, 2 main classes of therapy. The significance now is we have a new class of therapy, the radioligand therapy class. Usually we take it after chemotherapy, but in Dr. John's case, he had renal failure, which complicated things more, and he was probably unfit for chemotherapy, or he was afraid. He's going to describe that more. So anyhow, I want to just to shed the light on how significant the treatment is. I was sending Dr. John a message after 4 days from the first injection, and he was already saying, I feel I'm 30 years younger. I will not stress on this part because he will explain himself better than I will. He received 3 doses so far. That was the baseline scan. That was the interim scan after 2 doses. His PSA dropped more than 50%. His functions improved. His pain disappeared. And now he's living a happy life, and I want to give the floor for him. Please.
Thank you very much for this explanation. And Dr. Jean-Antoine, thank you very much, so very much for traveling to be with us today. Could you please share with us your journey with cancer and how did lutetium PSMA therapy work for you, if you had side effects, if any, and how did you experience this?
Well, if you talk of a journey, it was a journey, it still is. Long one, 2 years on standard anti-hormonal therapy. It was fine, and I was really confident things would be to the better side. But then, last July, I just didn't feel well. Something was wrong. Nothing really specific, but that vague feeling. I'm an anesthesiologist, and a research anesthesiologist. I decided to do a PSMA on my own. I went to the oncologist. He said, no, you just wait until January. I said, no. And I did it. And I remember it was at their center. I was shocked at the door. I was reading the report, and I went back inside. I said, are you sure this is me? It was. In 6 months, the cancer had spread dramatically. It didn't match the clinical picture much, but to me, it was really alarming. And I rushed to the oncologist. He called for chemotherapy. I said, no, this is not me. I'm not. He said, why? I said, no, I'm not going to that room, no. I asked for a couple of days, and I contacted Dr. Yehia. And I went on the internet and researched lutetium. That was a novelty. He said, it's there, you want? I went to the oncologist again. He said, are you an adventurer? Do you know what you're talking about? It's something, sort of an experimental drug. Are you really willing to go into that? I said, yes. I'm desperate. I've got nothing to lose. I've got every chance to win. And that was it. That experience on that first day is unforgettable. And I'm not saying this because I'm on stage. Ask him. I was half asleep on the chair with the saline drip. He injected me with lutetium. I wasn't even aware. 5 seconds later, I opened my eyes. He was shocked. He was shocked. I said, I'm hungry. He said, I'm thirsty. I want to go out. And it was a revelation. I became 20, 30 years younger on the spot. I'm not again saying this, I'm on stage. It is a fact. I repeat this on the second and the third dose, but then I got used to it. It's really fun, really fun.
Thank you, Dr. Jean-Antoine. Did you feel you were adequately informed about the treatment, and did you feel safe throughout this process?
Mainly yes, because I just said it, I'm an adventurer. I took the plunge, but my colleague doctor said, you must be mad. Inject yourself with a radioactive agent, and that potent, and I never forget the second dose PSA. I just tried to get one PSA 24 hours later. A figure I have never seen in my life, 5,300. I went to the lab and I had a fight with them. I said, this is not a figure to give me. Is this a PSA to give me? He said, we're sure of the results, 5,300. Probably, now that I know, it was probably the massive breakdown of the tissues instantly with the drug at 5,000. And then it went down to now we're at 150 up from 300. And the journey is going on.
Thank you. Dr. Jean-Antoine, could you please explain how challenges were it to access radioligand therapy in your country?
He took the challenge. I didn't. He took. Let's be honest. I just said yes, and then from then on he took the lead. But without truly, I mean, without oncidium and without the MRC, I don't think this was at all possible. But then I'm here to witness this. You want to believe? You want to believe? I don't know. It's so up to you.
And lastly, do you have a message that you would like to share with the medical community present here today?
Well, the messages are many. Of course, the standard ones probably tell you never lose hope. This is easier said than done. But you just have to, you can't beat science, you can't beat progress. You just have to have the courage to go ahead. If you tell me, try an electric car, probably a couple of years ago I would have said, you're mad, electric car. But then this is it. Things go fast nowadays. You can't really stop progress. And for those maybe who are not aware of this, I don't know if you're aware why it was called lutetium. Lutèce in old French is the name of Paris. And lutetium, and Paris is the city of light. So lutetium is all about light. Truly light. It's not light at the end of the tunnel. It's light there and then. Again, I don't know if this is, how far this is true. Same goes with gallium. Gallium comes from Galileo, the explorer. You're exploring the body. One of the best explorers in history, Galileo, gallium. So this is the message. Go ahead. That's it.
I think it was a perfect closing note. I will not read minds because it's perfect. Thank you very much, Dr. Omar, Dr. Jean-Antoine, Dr. Batool, for being with us.